Hi there, my name is Jessica. I also go by Jessie or Jess. This video you're about to watch is an interview with my friend Flora, where we discuss what a typical day as a telemetry nurse looks like, experience with imposter syndrome, and advice for nursing students during clinicals. Just to clarify some things, Flora and I used to work at the same hospital together, but right now we're working at different hospitals. And this interview happened to take place the day before Flora left telemetry and started a new position in the ER. So I will definitely have her back for anyone who's curious about what it's like in the ER. Okay, so I'm here with Flora. We used to work together at my previous hospital, and now Flora is making a transition into the emergency department. Yeah, so I asked Flora some questions just about her experience transitioning into a new department of nursing. What does a typical day look like on telemetry?
Typical day, I get there, I clock in, you have your huddle. Like for me, when I was day shift, you have your morning huddle, which is at 7 a.m. and your charge nurse from the night shift will kind of hand over to the day shift and kind of give you a rundown of how much staff we have that day, violence risks to watch out for, anything like any contact escalations, dropletting, anything we gotta know for the whole floor. And that's, I think, most of it. Just kind of look over your assignment, make sure everything's okay. And then you go out and you find the nurses that had your patients overnight and you get a report. And if some of them are busy, I tend to just sit down and look my patients up, just minimally. I'm not one of those that gets there early and like looks them up. I just prefer to get the whole story first before I dive deep into the chart.
Right.
Because honestly, I don't know how people figure it out otherwise. Because if you look at the chart, it's like information overload.
Right.
And you don't really need all that.
Right.
So I prefer actually just get the rundown from the nurse and then I figure the rest out myself. But yeah, you get report on all your peeps, and then I sit down. Sometimes if I have time, I sit down and then like look over my orders. But if it's a busy day and something happens right away, I have to just kind of go with what happens. And if it's emergent, you have to figure that out and then prioritize from there. What do you do next? And all day long, we just have to kind of prioritize your tasks and restructure what you're doing and delegating and try to fit in some breaks in between.
That's so true, yeah. Honestly, the whole day you're basically just, you have a plan of what you're gonna do and how you think the day's gonna go, and then immediately you get called to do something else, or somebody calls you, or the family wants to talk to you about a patient you haven't met yet. So yeah, that's actually what the whole day is all about.
You have to like reprioritize all day long, but generally in the morning you have to have your med pass done by like 10 a.m. But I also think something that no one ever told me is how things that are not time sensitive, and if things are really going down, it's okay if your meds are going to be late. I think I've learned so much about reprioritizing what really matters.
Right.
And as long as you know, even if you're behind on charting, as long as you know all your people are good and you get to know them and you do your assessment and you know everyone's baseline and you have done the most important things, everything else you can figure out later. But I just think I'm always like people first, and I just make sure I know my people before I can say I've charted everything I need and I don't really know who I'm taking care of.
So if you had a day go perfectly, would you go in and, after you looked up your patient, go in and do your assessments first, then do med pass, or would you do your assessment while you're doing med pass?
I generally pick out, when I do my research, when I quickly look at orders and see who should I see first, who am I worried about most, like which one sounds the sickest, which one do I think needs me first. Sometimes it depends who calls you first too. And so I try to bring everything in with me, like my meds, and I do my assessment with them. But if I don't see them get up, then I'm not going to make them roll around. I'll just go check out their back later, or I listen to the lump sums on the back, knowing that maybe respiratory is going to come and they're going to ask me to sit up, so I'll wait to do that. It just all depends, but I generally like to do my assessment with my pass.
Right.
People, yeah.
Yeah, no, that makes sense. And cluster care, and it helps get all that stuff done at one time.
But I think also as time went on, I was less like strict with those things, and sometimes I would, depending on what I can fit in, you have to like switch from one patient to another. If you have one medicine that is like time sensitive for someone else and you're in the middle of something, you have to go do that one task and you come back to them. So it's never perfect where you just finish one patient up. You have to like work things in as they come along, and unfortunately there's a lot of walking, so you have to like go back and forth all the time. But Med pass, ideally done by 10,
Mm-hmm.
and then usually we take our lunches anywhere from noon to like 4.
Mm-hmm.
So you sign up for a slot, and I tend to go around that 1. I'm one of the early ones because I'm usually starting by that time.
Mm-hmm.
I don't know how other people do it. They like eat at 4.
That's crazy.
What are you doing all day?
Yeah.
So I eat early, and then towards the afternoon, sometimes you discharge people, and you might get a few admits as well.
Mm-hmm.
And then closer to like 5 p.m. is when I start writing my notes, and I make sure I have all the. I usually like to look at my report sheet and make sure the story of the patient makes sense, or if there was anything. Because sometimes in the morning report, you think to yourself when you listen to the report, you're like, oh, this is what I want to look up because they didn't know the answer to something, or
Right.
you kind of like, oh, I would like to know this date of this surgery or whatever it was. And so then if there's any gaps in something that I think I would have liked to know in my report, and I try to give that on, I like look things up as I need. And then 7 p.m. comes around, and then you give report to the oncoming shift.
Nice.
That's
Very
a full
nice.
day.
Yeah, I like that. So you're working in telemetry. What made you want to switch from telemetry to the emergency department?
I feel like I'm someone who always wants to learn more.
Mm-hmm.
And I've always thought about like either ICU or emergency department, and I think what made it for me to change to emergency department is knowing that I never know what's going to walk through those doors and having to know everything, and also having the it's almost like a gift. You always get to see so many patients in a day versus having the same 3 or 4 patients in one day, and it's like sometimes if you're 3 in a row, then you see them for 3 days, and it can get a little old. And I think no one's their best if you feel like you already know this person and you don't like try as hard. But I think what I love is just learning more and more. And the emergency department enables me to be exposed to everything.
Yeah.
Traumas, psych, critical care stuff. Like I get to expose to that as well. Kids, like pregnant ladies, CHF, tele, like all this other stuff too.
Yeah.
Oncology. Yeah, everything.
So one thing I do want to talk to you about that I feel is relevant to all people, but especially nurses, is this thing we call imposter syndrome. And I've been feeling it a lot lately. Have you had that experience with imposter syndrome, especially starting out as a new grad or as a new nurse?
I think what I think of when you say imposter syndrome is that you feel like you don't belong. And I have to say, once we get out of nursing school, I did have some sort of confidence because of the clinical, so I kind of had confidence that we were where we were supposed to be,
Right.
kind of not knowing anything in the beginning.
Right.
But it feels vastly different coming from nursing school, starting a new job where it's accepted to not know anything, and any question is a good question because you're not expected to know anything.
Right.
But I think now, starting a new job, coming from a nursing job, there's a lot more expectation that's placed on you.
Yeah.
And I feel like I'm already starting to think, I don't know if I can ask these questions, even if it's about rhythms or something cardiac related, because I technically am a cardiac nurse, but I've only done it for 2 years, and I feel like every day I've worked, I've always learned something new. So I feel like I find it normal for people to still ask. But yeah, now transitioning into a new job, I think I do feel it a little bit, like just anticipating that I'm going to feel it more this time around. Because I think starting this new journey, it's going to be so different. And in a way, I'm like, I don't know if I'm ready for that, because there's going to be so much to be asked of me. I think if there's one thing I've learned, and that's kind of why I love this field so much, is because I don't expect myself to know everything. I mean, I've definitely felt certain aspects of imposter syndrome in the past, or like felt like, oh, why don't I know this? But I think in this field, and that's with our coworkers too, I don't think anyone knows everything.
Right.
And I think I appreciate those people more that know they don't know everything, because that makes you ask more questions. And I don't know where I've heard this before, but I think the most dangerous new grads or dangerous people in general are the ones that think they know everything.
Right.
And I think especially in medicine, there's doctors that don't know everything, and they have to continuously, that's why we have to like do continuing education in medicine, because things change all the time, technology involves, and it's just not, I don't think it's expected of us to know everything, and it has a lot to do with our ego, I think.
Right.
And that's something I had to struggle with, because it's hard to admit that you don't know something in front of anyone.
Right. Right.
But with patients, I think you don't want to lose this respect that you have, like
Right.
we are in some
And that
sort
trust.
of authority. Yeah, the
Yeah.
trust. But if it's something, now I feel like I know more, so if I don't know something, I don't mind speaking up and saying, I'm actually not sure, I'll look that up just so I don't tell you the wrong information.
Right.
Because I do feel like I know other things, like I'm sure of other things,
Mm-hmm.
and it's okay for me to admit that I don't know this particular thing, like if it's a medicine that I don't give a lot.
Right.
I remember in the beginning when we would do med reconciliation with patients, and I wouldn't recognize a lot of the most common ones, where I'm like, oh shoot, what was this one for? And I would be more hesitant to ask the patient, oh, can you remind me, what do you take this one for? Or instead of Googling it, because sometimes patients do know best.
Yeah, totally, yeah.
But now where I'm like, in 99% of the meds, I'm like, okay, I know what they take it for, I know what it is, all this stuff. So every once in a while when there is one that I don't know, I don't mind asking them, hey, I don't really see this one often, what is this?
Yeah, sometimes I think that's like the difficult part for me with nursing, I guess, is just there's so many other people involved you have to rely on for answers versus having the answer yourself and being able to give that answer confidently to your patient so that they feel like they understand what's going on too. So I think that's been my difficulty with it. But knowing that other nurses also don't have all the answers helps actually.
Yeah, I don't think it's a perfect field. I think it's kind of why we like nursing in a way too, because it's always like there's more room for growth, and it's just not very easy, and you're always like scrambling. But it also pushes you to know more, because every time you are exposed to something you didn't know, now you always know. Like the example you told me earlier about the JP drain, like now you know at your hospital you get to pull it,
Right.
and now you're totally well versed in it, and it's just what comes with the territory when you're new somewhere.
Right.
But soon enough, another year or so, you won't feel that way anymore, and you'll be showing other people how to remove JP drains.
Right.
Hopefully.
Yeah, no, okay. So, what advice do you have for nursing students in clinicals?
Advice for nursing students in clinicals. I would say make sure you stay attached to the hip with your nurse, because the nurse is already busy, and having, as much as I feel like when I was a nursing student, I thought that they would have like a chiller shift because they have me as like their little slave to do whatever.
Right, to help, yeah.
But now knowing what it's like on the other side, as a nursing student, you only know like 2% of what's going on at all, and all the responsibilities. So I think realizing that you're actually added work for the nurse, and then looking at it from that perspective to really try to be there when things are happening and to be as much help as possible. And I also think I underestimated back in the day how much help it actually is just doing little errands for them.
Yeah,
like,
yes.
Oh, can you go give a pencil to this patient? Can you go empty this urinal? Like whatever it is, it helps so much. So much.
I totally agree with that.
And I think to just be ready to do whatever, that shift, and not be so focused on, oh, well, she only let me wipe, people's butts, or like whatever it is. There's a technique with everything, and even changing people's briefs, like, I don't know, I just think everything is important to know.
I agree. Yeah, you never know what you're going to find as well. And I think, yes, it's just important to follow the nurse, and to also, those little errands make a huge difference in time.
And you learn something with it too. And like ask a lot of questions. Anything you don't know, like if the nurse doesn't have time to answer, just write it down and ask her later when she has a time or whatever it is.
Yeah.
Just make sure you get the most out of it.
I agree.
Out of the shift.
I agree. And I also think that like with being a nursing student during clinicals is just such a small part of your nursing career, that if you feel like you're not getting enough during your clinical time, that you will get that experience when you're on the floor during your preceptor shift, during your new grad, or just on your regular shift when you start on your own. So don't feel like you're missing out or like you're behind. You will get experience at some point.
Yeah, but it is, you have to take it into your own hands. Don't expect the nurse to like walk you through everything and bring you all these experience too. You have to really go out and find them. And if your nurse isn't showing you anything, then maybe go find someone else that can show you that something, or be more proactive with it.
Yes, be proactive. I agree. Thanks, Flora. Thanks so much for coming and for answering all my tedious questions. I'm excited for you.
I'm excited for you.
Thank you all. I'm excited for you to go to the ER, and you'll have to come back and tell us what the experience is like.
Oh, I would love that.
Yeah.
That'd be really fun.
Cool. Thanks.
Thanks, Jess.
Please leave a comment below if you have any questions for me or Flora, or any future videos or topics in nursing you would like to see. Thanks again for watching.